After months of everything shut down, everyone is looking to resume a little more of a normal life. But they can't do that if they don't feel safe. Recently, I've been concerned about reports of criminal activity impacting our tow truck industry, increased incidents of domestic violence, and shootings in our communities. It breaks my heart to hear the things like earlier this month, 6 shootings within 24 hours in Toronto. It's wrong, it's unacceptable, and it has to stop. My message to the criminals out there hasn't changed. We're coming after you, and we'll throw the book at you, and we're going to put you behind bars. We're going to keep up with the fight against these crooks who rob victims of their dignity and safety, and who rob our communities of the chance to rebuild. And today, we're taking $6 million, that's $6 million that our brave police officers across the province have taken from the hands of the bad guys. And we're investing that money over 3 years into 21 projects to combat gun and gang violence, to combat human trafficking, and to combat sexual and domestic violence in all its forms. Our police are using this funding for important work across the province. South Simcoe Police Service will be training their officers to gather intelligence on gang members and activities, and combat organized crime in their communities. The Toronto Police Service is expanding Project Engage to work closely with 12 neighborhoods to help divert our young people from gangs and go after the thugs who are recruiting them. And then there's the Spirit of Hope project, run by the Treaty 3 Police Service in Kenora, to build community awareness of sexual violence and human trafficking and reduce incidents of crime against Indigenous women and girls. And these are just a few examples. Too many of our young people are being recruited and preyed on by these gangs. Too many of our young women and girls are preyed on by human traffickers. It's disgusting, and we're going to work with our police partners to intervene earlier and stop these heinous crimes. I want to thank all of our officers and police staff who have been out there during this pandemic, keeping our streets safe. They're absolute champions, and I support our police 100%. And I am working with our all-star team at Queen's Park to make sure every young person in this province has a fair shot at reaching their full potential, no matter their race, creed, or background. My friends, we will rebuild a province without fear, with safe streets and safer communities, and with more prosperity and opportunity than ever before, for our young people, for our communities, for everyone. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Dunlop.
Thank you, Premier. It's a pleasure to be here today as co-lead of our government's anti-human trafficking strategy. Ontarians will agree criminals should not profit from inflicting trauma onto communities and individuals. Simply put, crime should not pay. Through the Proceeds of Crime Frontline Policing Grant, our government is reinvesting $6 million over 3 years into frontline community safety initiatives. This grant funding is from assets seized from criminal prosecutions, and it's going back into the community and back to victims and survivors to help them heal. The steady increase in domestic violence, human trafficking, and sexual violence is alarming and completely unacceptable. These horrific crimes can create long-lasting trauma, so it is vital we provide supports to prevent them and to intervene early to support those impacted. It is clear we need to work together to make this a reality. We all have a part to play in looking out for and combating these crimes, which is why our police services are working in the community to provide them with what they need. This is not a top-down approach, but working with those in the community who know what is needed. These projects will address 3 key priorities: human trafficking, sexual violence and harassment, and gun and gang violence. This means funding for education campaigns aimed at groups susceptible to becoming victims of human trafficking, such as women in low-income groups, Indigenous and immigrant women, and at-risk youth. Training for frontline officers responding to victims of sexual and domestic violence, and resources for survivors of sexual violence and human trafficking. Today's announcement is one more step forward to supporting our commitment to protect children and women end violence, exploitation, and abuse, and get guns and gangs off the streets in our communities. Public safety and supporting victims and survivors is and will always be a top priority for this government. Thank you.
Well, before we take questions, Christine, I'd just like to give a shout out to some incredible people that I made a pit stop over at West Park Healthcare Center in New York. And these are the greatest PSWs. I just got a massive spot in my heart for these PSWs. They're so down to earth. And this is what I talk about, folks, when, you know, compared to being stuck down here, you get out and you listen to great people, no matter if it's companies or these PSWs. And I just wanted to give them all a big hug when I saw them, and I just want to give them a shout out. But before I run through a list of names, you look at these PSWs, how hard they work, and you listen to their stories. No matter if they were telling me, you know, they have to bring 10 seniors, and these are the most ill, as I say, close to palliative care in these long-term care homes. They have to get 10 ready for breakfast. They come in an hour early and don't get paid. You know, that's just not right. They need more. They need more support, and we're going to give them more support. They also, I love one of the PSWs came up and said, you know, I need more work. I'm a single mom. I have rent to pay. I got my kids to take care of. And I said, how many hours do you work? And they said, bi-weekly, 75 hours. And I'm thinking, okay, that's almost 40 hours a week. But don't you love that attitude? Someone that actually wants to work. Doesn't sit there, none of them have their hand out and saying, here, you know, I want something for nothing. You know, I can sit at home. They aren't saying that. They're actually saying, I want to work more than 40 hours. I want to get time and a half. And then a dietitian, PSW came out, or maybe a nurse, and said, hey, I want to get overtime. But what a great attitude that is. We are so fortunate to have these PSWs. And as far as I'm concerned, I know I talked to the Minister of Health, and I know I might open a can of worms, but they are grossly underpaid, in my opinion, and under the ministers. And I know the next question from the media is going to be, what are you going to do about it? Well, we'll sit down. We're going to come up with a solution to support these people. They're underpaid. As far as I'm concerned, they're overworked. And I just want to tell you how grateful I am. I know this is very personal to myself and Carla, and it's personal to the minister too. She talks to these folks every single day. So I just want to tell you, we have your back. Give us some time. I'm there to support you, and I just appreciate everything you're doing. So a quick shout out, and hopefully I don't miss any names here. So a shout out to Marilyn. You're fabulous. Marilyn was kind of like the commander-in-chief there. So Marilyn, Avis, Marie, Gloria, Susan, Dorothy, Lisa, Adme, Gwen, Cynthia, Grace, Devaline, and Arnola, and Shiyu, and Nab, and Kamisha, Yvonne, Teresita, I think Teresita. I apologize. Ali and Juliana, and Katie and Vanette. These are wonderful people. All came out and said hello. I love our PSWs, and we'll be there to support you. So sorry for the little delay, but it's important, so important to recognize these people. And it's hard to pick and choose because we have phenomenal frontline workers. We have the nurses that are just busting their backs, the docs, the frontline, all frontline healthcare workers. So I love all of them. I just want to clarify that, and we're ready for the questions now.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
First question comes from Michelle McQuiggy from Canadian Press. Please go ahead.
Hi, Michelle.
Hi, Premier. I'm picking up where yesterday left off and asking a bit about education.
Absolutely.
The hospitals that put out the plan that you say formed the basis of the return to school plan, put out a statement late yesterday. You've been saying all along that you're following their advice, and indeed there are many aspects of their plan that are part of the provincial strategy now. But they do emphasize the need for small class sizes and physical distancing. What is it exactly that made your government decide not to follow that particular piece of advice, and do you plan to revisit that in light of the fact that they're pushing back?
Well, let's be very, very clear here. I want to get as small classrooms as possible within certain parameters, and we did take their advice. And yes, I could sit back and say, yeah, could we have 5 5 to a class, but let's make no mistake about this. We have the best plan, bar none, over any province. All the other provinces are shouting and screaming saying we want Ontario's plan. But I'm going to hand it over to the expert that was instrumental in putting this plan together through the guidance of sick kids and other professionals. But I can tell you, I'll always take the advice off world-class pediatricians and infectious disease experts over head of any union or head of union stewards, because that's a little bit of politics are being played here. And I'll always take their advice, and we are going to do everything we can. As we said, we had $30 million for additional staff, and we have $50 million additional dollars to put 500 nurses in the schools. I could go on and on, but I'm going to let the minister run through this with you. Thank you.
Thank you very much. So, you know, the government unveiled a plan that is investing over $309 million more. We are spending more in this province than any province in this country. In fact, more on a per capita and a per pupil basis than British Columbia, the Democratic government there. We recognize there's more that the government can do, and we have stepped up in a significant way to ensure that Ontario leads the way with a plan that for the first time in Canada has the most comprehensive masking policy, full stop. In fact, we're the only province to have mandated masking from grade 4 up, following those very hospitals' advice on the merits of masking, particularly in the upper years. We're the only province that has embedded public health by having 500 nurses within our schools providing training, testing, and screening to keep our kids safe and ultimately our staff. We're the only province in this country that has a credible, bona fide surveillance testing program for high school students. We are hiring in Ontario, benchmarked to any province, more custodians, more mental health supports, more cleaning, and more sanitation products. So I think what I'm underscoring with the Premier, I think, is making very clear is that this plan, informed by those experts, called for, the consensus was, a multitude of actions, layers of prevention, looking at every single way we can de-risk the circumstance. And, you know, what I think is important is that this $300 million responds to those challenges. But I also think it's important that families know, when the Premier said we will do whatever it takes, he means it. The fact is, a month ago, we announced a $700 million investment for the restart of schools, part of our grant for student needs. Then a month later, going from an adapted model to a conventional model, we stepped it up with $309 million more dollars, public health nurses, testing, screening, more cleaning. The fact that we're hiring almost 1,300 custodians net new in Ontario, I think underscores that principle. But what we're also saying is that we're going to be solution-oriented. We're going to work very closely with the medical minds in this province, with our unions, with our school boards, with parents, to make sure that this living document is only strengthened over time, that we could do more, and I think we can. And I know that there's areas where the government has already indicated we want to reduce those classroom sizes, as was noted, a $30 million investment to hire more EAs, to hire more teachers to achieve that very objective. And the other part of our plan is to respond to the community transmission risk. As I said, our actions today, you know, for friends watching in the province, our actions today will have a significant consequence on learning tomorrow. The fact that for 4 days in this province, the people have been adhering to public health advice, we have under 100 cases of COVID, is a positive sign. But we must stay vigilant, because if we do so, we could ensure kids could go back to class each and every day in the fall and beyond. So I just want to make clear, we've put the investments in place. We lead the nation in the context of that investment, but we're also open and willing and stand ready to listen to everyone, particularly our medical leaders, to do more to further de-risk the circumstance and just keep these kids safe, which is our obligation.
Follow up?
Thank you both. Yes, a follow-up for the Premier. Some time ago, you announced that in conjunction with the federal government, a deal was struck that would see Ontario get about $7 billion of additional funding. Do you have any plans yet as to how that money is going to be spent, and do you know when it's going to land?
Well, hopefully it's going to land sooner than later. We're asking the feds. We have to get this money flowing to get it out to the certain areas, but I'm very grateful for the federal contribution. And we had a hard discussion about it, and I'm glad that they came to the table, for especially municipalities and the transit that we're in desperate need of, supporting them as well, along with PPEs that, again, we're in need of always. always need the PPEs and other social issues throughout the province that we have to take care of. So as soon as we get the money, we'll start flowing it immediately. But I should have an answer hopefully over the next week or so to give you an exact date. The federal government, and respectfully so, they announced it, then we went out there. So we'll get an answer when the money's going to start flowing across the country, because when it flows to Ontario, it's going to flow to the other provinces as well. But I just want to say we're grateful. We're putting tens of billions of dollars out there to support the people of Ontario.
Next question.
Next question comes from Ashley Legasic from News Talk 1010. Please go ahead.
Hi, Ashley.
Hi, Premier. Thanks for taking my question.
Thank you.
This might be a bit long-winded, so
That's all
bear
right.
with me, but I want to provide some context.
I get long-winded
I
too.
spoke with the I spoke with the ODSP Action Coalition this week, and they say taking away their $100 a month pandemic benefit is detrimental to some of them, to people who are already living on a limited income. They say their costs have gone up during the pandemic, having to take Ubers more frequently because they're afraid to use public transit, getting grocery delivery for those who are immunocompromised. So my question is, why did the province decide to end that benefit in July when it was clearly helping people who are barely making ends meet?
Well, our goal through $17 billion that we're spending is try to support everyone possible. And then there's a certain group that are collecting ODSP that have part-time jobs, and if they keep the CERB going and their part-time job, they're actually up a few $100s, not down. But I understand people are struggling. I get it. I fully understand, and we're doing everything we can to support everyone across the province. And the best way to help people on Ontario Works or ODSP, if they're healthy and they're able to work, get them a job. Help get them a job. And speaking of jobs, by the way, I've been hearing from a lot of employers that they have a tremendous amount of jobs available, and people just aren't coming back to work because of the CERB. That's concerning. I understand it, but it's concerning that people aren't going back to work. I hear more and more now that people have the jobs available, but people aren't showing up. So that's concerning. But we're going to be there to support people right across the board, no matter if you're on ODSP, Ontario Works, or any area. We're doing everything we can to support these folks.
Follow-up.
And I guess my follow-up would just be on that last point you touched on. If I could get an idea of what kind of industries are you hearing that from, that people aren't coming back to work? Is it across the board? Is it certain industries where they were making less than what the CERB provides?
Well, that's a very good point that you mentioned, because the CERB's $2,000, and their job might be paying $2,500 or even up to $3,000. And some people, not all, some people are sitting back thinking, I'm going to take the rest of the summer off and I'll collect the $2,000 and not worry about the additional $500 I can make. But I've just been hearing it more and more right across the board. When I was in the Niagara region, a company was mentioning to me, almost every company that I speak to is saying we have positions, so we just need people to get back to work. I believe in supporting the people that need help, especially through this pandemic when we had to shut everything down. I get that. But now when we're opening up and we're going into stage 3 and companies are calling you back, I encourage you to go back to work, because legally, if they call you back and you don't come back, then you lose your job. That's up to the company, but you won't have a job anymore. Someone else will fill you those shoes, and CERB's not going to last forever, as we all know. So I encourage everyone, when possible, go back to work. And I realize it's not always possible, but if you're healthy, go back to work.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hey, Premier. There's a growing call from the opposition, from parents, from educators to lower elementary class sizes to at least 15 kids per class. I'm sure you know this. They say there's creative ways to do this, teaching in gyms, libraries, outside, or unused buildings. Have you given any consideration to this, and do you think it's at all possible?
Before I pass over to the minister, we've had numerous discussions. I've actually said this on news conferences that we encourage, when the weather's permitting, to go outside. And as for the JK and senior kindergartens, there's 2 cohorts of 30 kids in the class, separated 15 in each, and we have ECE and a teacher, so it's really down to 15. But I hear the parents. I hear you loud and clear. But keep in mind, we have the best plan in the country, bar none. We have the lowest number of kids in the classroom in the whole country when it comes to JK and grades 1 to 3 as well. But again, I got to hand it over to the expert. I got to compliment the Minister of Education. My opinion, I've been in this game a long time. There's never been a better Minister of Education than Stephen Lecce. And he knows this file inside and out. And his #1 priority, as mine is, and our government, and our parents, and everyone else, is to protect these kids. And we aren't sparing a penny. But do you know what was ironic? The minister was telling me, I don't know if you're going to say it, but I'll say it. He spoke to 18 MPPs yesterday. And they talked to a lot of people. And a lot of people out there are saying, great plan. We look forward to getting back to 5 days a week. So that's what we're hearing. So we'll leave it up to the minister. Thank you.
Thank you, Premier. I think what we're hearing from the overwhelming amount of parents is they want us to seek the advice of medical experts on the way forward when it comes to dealing with a pandemic. And our government has really listened and leaned on some of the best medical and pediatric minds in this country. And we've been informed by discussions from the command table to listening to input and feedback from sick kids to a variety of other institutions. And we're grateful for their advice. I think what we are hearing overwhelmingly is that by having more investment in masking for grade 4 and 8, ensuring at least 1 meter of distancing, which by the way is consistent with virtually every province that has a position on distancing. Either they don't have a distance requirement or it's roughly 1 meter. We're the only province in Canada that has requested and demanded or imposed a masking requirement on students from grade 4 and up. And now other provinces seem to be interested in perhaps following that lead. So when it comes to how we could de-risk the circumstance for elementary schools, it's largely about masking, an element of distancing, and a bit of a reality check on classroom sizes. Because as the Premier said, in grade 1 to 3, for example, Ontario, for 90% of classes, are capped at 20 students. The next 10% could vary up to 23. We have, by far, the smallest classroom size in the earliest years in the country, full stop. In fact, there is no major province I'm aware of that has in any way adjusted their numbers, their caps, or their ratios. Now, in kindergarten, as the Premier noted, there are 2 educators within that space, and the average is about 26 in that class. But what we've done to ensure distancing could be achieved and these kids could be safe is we've added $30 million, part of that $309 million net new investment, the largest investment in Canada to ensure a safe restart in September, is to hire more teachers, more EAs to support that. And I would also want to make clear is that we will continue to step up in significant ways to respond to the risk as it emerges and to demonstrate to parents in action more than words that we are going to do whatever it takes. And when it comes to adding more staffing, when it comes to more cleaning and custodians, when it comes to the only province to actually do surveillance testing with public health nurses embedded in schools, everything we've done is because we've listened to the signs that you have to take a multitude of actions, layers of prevention. And we're going to continue to do that. We're going to continue to listen to the experts, and we will continue to be there for our parents and for our kids. And if that requires additional resource investment, we will do that. We just announced, friends, a $300 million investment and enhancement, which is larger on a per capita and per pupil basis than the new Democratic government of British Columbia. I mean, we really do lead in this respect, but I know there's more we can do. We're going to listen, work closely with the medical experts to get this right, because at the end of the day, when we're talking about our kids, we will not spare an expense. We will do whatever it takes to keep them and our staff safe in Ontario.
Follow-up?
Premier, I just wanted to ask you about your comments yesterday. You said you pray to God that everyone's safe, and if it was up to us, you'd have 5 kids in a class. There was a lot of reaction to that because you are the leader of this province, and it is up to you. So why are you saying that you don't have control over your own plan, and can't you change it now to respond to some of these concerns if you want to?
Let's be very clear. We have full control over the plan, and yes, I do pray to God and no one ever gets hurt. And maybe that's a figure of speech, but I do. And do we all want smaller classes? 100%. But I think the plan is phenomenal. It's the best plan in the entire country, bar none. People are touting our plan in every single province. And I think Stephen Lecce, the minister, has done an incredible job with the support of the advice of some of the best pediatricians in the world. So we're doing everything we can. We're throwing everything in the kitchen sink at this. And I'm a strong believer in our plan.
Next question.
Next question comes from Stephanie Smythe from CP24. Please go ahead.
Hi, Stephanie.
Hi, Premier. This question, I'm going to take you back to Canada's Wonderland and the reopening protocol. CP24 has obtained a copy of the protocol that was presented to the province and some health officials ahead of stage 3. And the rationale for not allowing Wonderland to open seems to be the concern for large gatherings and the high-touch surface areas. But the parks plan notes comprehensive protocols, including capacity control and a reservation system that would allow physical distancing. They've got a 300-acre park outdoors. There's enhanced cleaning for high-touch surface areas every hour in this plan. It looks as though they're covering all the bases required to reopen. They've been implementing these protocols for stage 3, but then they say they're surprised to learn they were held back and delayed even further while other attractions like Marineland are permitted to reopen. And not to mention that they're employing and training seasonal staff right now in anticipation of stage 3. So what really is a holdup here? Not many weeks of summer weather left.
No, I understand, Stephanie, and I just find it ironic. Some people want Wonderland open, but the same questions are coming at me. How about the kids? Guess who goes to Wonderland? All the kids. Who's going to be stacked in the line? I understand there's social distancing as well, but you can't compare Marineland that's going to be showing a water show versus kids in a lineup. And don't get me wrong, I talked to the general manager over at Wonderland. He's a great person, put together an incredible plan. I'm going to hand it over to the Minister of Health in 1 second. There's nothing more. We'd love to do that, but I have to take the advice of the health table, the health experts, of public health, and they just aren't comfortable right now. And I just find it so ironic. We're talking about protecting the kids, but some people want all their kids to go to Wonderland. I don't know, it doesn't make sense. But I'll pass it over to the Minister of Health.
Well, it is something that we take very seriously, but we also need to rely on the evidence, the clinical science behind all of this, and the public health experts, Dr. Williams and his team, still feel that we are not at a stage where these large amusement parks can be open. The risk is still too great, and we still need to continue to follow all the public distancing measures that we've talked about before. Just because we are moving into stage 3 and most businesses have been able to go back into business, it means that the public health measures are more important than ever. So we do need to maintain that physical distancing, to wear a mask where that can't be achieved, frequent hand washing, and so on. So we rely on the expert advice of our public health officials, and that's what's guided us all the way along till now and will continue to guide us.
Follow-up?
Okay, thank you both for that. I wanted to ask you, Premier, about a situation in Toronto today. We have had a second crane collapse in downtown Toronto in a month. One crane collapsing in the city of Toronto is one too many. Sure. What are your thoughts on this, and any concerns about inspections when it comes to Ministry of Labour or anything? Your thoughts?
Well, the Ministry of Labour has really ramped up inspections on all construction sites right across the province, and I know they're there and they're going to be reviewing it. But you're right, Stephanie. I can't remember the last time a crane collapsed like that. So obviously there's an issue. I don't know if it's the same company or when they erect the crane itself, but I have confidence in our Minister of Labour. They'll get down to the bottom of it, and once I get answers, then I'll be able to tell you the answers, what went wrong and what happened. Because again, I can't remember for all the years I was at City Hall, a crane collapsing. So there's definitely two back to back. There's an issue, but we're onto it.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Just to go back to your shout out to the PSWs, I also noticed when my mother was in long-term care that they were doing a great job. How much do you think they're worth? an
Oh,
hour.
I
Now
can't-
they're like 20, low 20s.
You know, some I can't put a figure on that. That's up to the, sorry, the Ministry of Health and sit down. But I know one thing: they're underpaid, and that's my personal opinion, and that's the opinion of the Minister of Health. Now we got to find some money to support these folks, and I can't commit to anything right now. But they're wonderful people. They work their back off, and I got a massive soft spot for these PSWs, all of them actually, not just PSWs, but because I hate picking and choosing. But I had a conversation with them, and you know, they just work their backs off, these folks, and they have a lot of struggles. They're trying to pay their rent, take care of their kids, and a lot of them are single moms. And man, it's heartbreaking when you get and you talk to these folks. So we're going to do something for them. Just stay tuned. We're going to make sure we support them.
Follow-up?
Okay, thank you. And I'll change gears for the second question. Today we learned from the Chatham-Kent Health Unit that they've had a bit of a spike in cases, including 12 people from multiple families who are on a boat trip together. And the health unit said there are a lot of contacts, large numbers to trace. So what do you have to say about what some people still appear to be doing, and how does that bode for the future?
Rob, it's unfortunate. We have to practice social distancing, as the Minister of Health said. This isn't over, and even by the way, when we hopefully we'll get a vaccine by January or sooner, it still won't be over. You know, we have to still be vigilant and practice social distancing, and that's why I think it was a couple of weeks ago there was a concern about tour boats, and we just didn't want the tour boats because you know things happen. But we're going to be vigilant. We're going to continue making sure we monitor the situation, and people just have to respect, and they have, by the way, the Chief Medical Officer's protocols and the guidelines that they've set out. So we'll be onto it, Rob. And by the way, Rob, I was looking for you yesterday down here. I hand-picked 5 beautiful peaches off this tree for you. So I brought in the peaches. I don't know where the peaches went now. Maybe someone else in the media got them. So I just want to mention that.
Last question.
Last question comes from Randy Rath from Sage TV. Please go ahead.
Hi, Premier.
Hi, Randy. How you doing?
Good, thanks. Yesterday in Caledonia, the OPP tried to enforce a court order removing protesters from a housing development. The police action failed, and the result's an ongoing demonstration on Argyle Street. What do you make of this situation, and what do you think should be done to try to resolve it?
Well, you know something, I'm just so disappointed when I heard this again. We have a phenomenal, myself, and I give all the credit to Minister Rickford, have a phenomenal relationship with Chief Archibald and all the chiefs that I've met. And they're such an incredible community. And you get a few of them out there that want to do these things. And what really is so disturbing, and the people at home listening to this will appreciate this. These people put their whole life savings to buy a home. And then someone comes in and just says, I'm taking over. It's just wrong. There's one country, one law, respect each other. And when the Indigenous communities or Roseanne or anyone asks me for something, I say, you know, they say jump, I say oh hi. As soon as they ask for something, bang, I'm on it within a second. And I have a great deal of respect for these communities right across the province. We're there to support them and help them. But there has to be a two-way street here. You know, you just can't go in and just take over people's future homes. It's wrong. And then when the police come, this is where the people at home are really going to, they get an outhouse, toss it over from a bridge onto a police car. Then they start throwing rocks at the police car. Like, enough is enough. You know, I'm just losing my patience. I can't direct the police, and I won't direct the police. But people have to obey the rules. I don't care where you come from, you know, what your race, creed, color, whatever. We have one country, one rule, and that is it. Simple. Respect each other. Because I have a tremendous amount of respect for the Indigenous community, and there's just a few, couple dozen, uncalled for. It's unacceptable. I better stop there.
Premier, are you afraid that this situation is going to escalate? As you say, there was rock throwing both at the police and at the fire department, responding to things burning. The police had to, or the police responded firing rubber bullets. is just the whole intensity and level of this thing concerning?
It is. This is not Ontario. That's not Canada. You don't start throwing rocks. You don't start tossing things. This is about living together, working together. When the Indigenous community, and believe me, 99.99% are just phenomenal people, absolutely phenomenal, and I love them, and they know I do, and we get along phenomenal. You get a couple bad apples that want to create problems, and there's an issue. So, you know, I reach out to all the chiefs out there, or not even all of them, you know, certain chief that can talk to these folks. I'm open, sit down, talk to me. What's the issue? I'm always there for you, I always support you. Anything you need, like I said before, instantly, we get it done for you. So it has to be give and take. And 99.99%, I keep wanting to emphasize that, are phenomenal people. So I better wrap up there.
Thank you, everyone.
Thank you. All the best. You take care.